Hi everyone, welcome to ClimaTalk's interview series, where we are interviewing people around the world that are contributing to COP-related issues in all different sectors. Today, Leonie and I, from the COP26 team at ClimaTalk, will talk with Anna Fuhrmann and Sonia Roschnik from the Healthcare Without Harm about their work on climate change and health and how they are contributing to make the healthcare system more sustainable. So I'll hand over to Leonie to ask the first question.
Yeah, welcome Sonia and Anna. Nice to see you here. First of all, climate change affects the social and environmental determinants of health: clean air, safe drinking water, sufficient food, and secure shelter. What do you expect the health consequences to be in Europe if we do not keep warming to less than 1.5 degrees? Maybe we can start with Sonia.
Thank you. Well, of course, we are already seeing the impacts of climate change with flooding events and hot summers and, fires. So all of these impacts will just increase. And of course, because in Europe we are so close to the Mediterranean, a lot of the diseases that have been mostly contained to Africa and maybe the very southern Mediterranean, they're likely to creep up into Europe quite significantly as well. So we'll see diseases that we have not been used to dealing with in more northern parts of Europe, and we'll see adverse weather events that will impact. And I think because of all of that, we'll also see economic migration, economic issues, just like we've seen with the pandemic, that will also impact on people. So it will impact on people's mental health, and that is quite an important aspect to consider, because often we talk about the sort of immediate physical elements or diseases, but mental health is probably going to be one of the toughest elements to consider. So all of those will just increase unless we are putting in place the right kind of mechanisms to support people.
Mm-hmm. And now if we look the other way around, Anna, how is healthcare and how are healthcare institutions contributing to climate change?
Well, healthcare institutions are contributing with their very energy-intensive healthcare that they're providing. Healthcare uses a lot of energy, a lot of water, a lot of resources, and a lot of those resources are single use, which opens up a whole other problem as well of a lot of waste. And with all that, the healthcare sector basically contributes to the problem of doing the opposite of what it's supposed to be doing by making health worse instead of keeping the population safe.
In 2015, Sonia, you reported on the UK's healthcare system and its preparation for climate change for the Sustainable Development Unit of the NHS. Could you just briefly maybe outline some of the key findings from that report and how you think the healthcare system has progressed since that last report?
Well, it's a very good question, because in the UK there's been a lot of work done to try and reduce the carbon footprint and to reduce the aspects that are contributing to that. But there is in the UK there is a Climate Change Act that requires different organisations to assess their readiness for climate change. And when we did that report, it was the first time that a sector looked at itself in its entirety to say, how is the health sector as a whole ready for this? And the basic conclusion is that we have not been thinking about it enough, and that not only is there requirements at institution level to think, well, is my hospital in a flooding zone? What are the sort of local impacts? How are heat waves going to be? Are we aware of the vulnerable people in our population? So there's a whole sort of service orientated thing, but then there's a wider population health piece, which is being considered, but it's being considered in separate bits. So like through a heat wave plan or through a flooding plan, but not integrated as one. And the main finding from that report at the time really was that we needed to look at it at institutional level and at local population level, but then bring all that intelligence together so that it's looked at a national level as well. Because just to sort of to stretch the point, if you think of the UK, there are certain towns or small villages on the coast, some will probably disappear completely in the course of the, by 2050. And some key decisions will need to be made, which cannot just be made locally. They need to be made nationally about, how are we going to manage the fact that some villages might disappear or some towns might be really at risk, and others less so? And do we want to, put in place some big policy decisions now so that we are prepared, rather than suddenly finding ourselves making those decisions when houses are falling off the cliffs? So that sounds very extreme, but it's trying to illustrate that we have got time now to consider these things ahead of some of the biggest issues hitting us. And I think that would be wise to do, just like the railways are looking at, how do they make sure that the railway lines don't buckle when it's very hot, for instance. The health sector needs to look at that. Where do you position your hospitals in the future? How do you support vulnerable people? So the next part of your question was, have we progressed much on that? And I would suggest that there's going to be another report out this year, which again looks at how prepared we are. And I think there's going to be more data in the report this year. I think 10% of UK hospitals are in flooding zones, for instance, which really makes you think you've got to do something about, considering whether some of those might need to move, whether you need to put in place some water management systems, or whether you need to move the plant. Often the plant in hospitals is in the lowest part of the building. Do you need to move it up to the top so that you can afford to flood on a regular basis? I used to work for a hospital in Cambridge, and regularly the lower floor would get water. So this is something that's real now. And I suspect that although we're getting better at sort of integrating weather plans, like heat, cold, and all of those elements, and being much more and more coordinated around those, I suspect we've still got a long way to go to be properly prepared.
Well, thank you very much, Sonia, for this example. It just illustrates how important it is, the connection between health and climate change, and that we really need to look more into it. And maybe, because Anna, you work as a climate officer for Healthcare Without Harm, can you tell us what the organization aims at, and what exact role it is that you're filling out, and what motivated you to do or to become a climate officer?
Well, that's 3 questions at once. What Healthcare Without Harm is doing is, in the climate program at least, we're helping hospitals to calculate their own emissions, calculate their own footprint, and work on reducing that footprint, as well as working on assessing their resilience and improving the adaptation to all the risks that Sonia has talked about. And we also support hospitals in being leaders. So talking about the issues that climate change is going to bring to health, and making it public knowledge, and asking also local, national politicians to actually make the right decisions to keep the population safe. And obviously, we're not only working with hospitals, but also with healthcare professionals, with the Nurses Climate Challenge, or with the Doctors for Greener Healthcare. And on another level, we're also working with health ministries or environmental ministries. That project is called Operation Zero. So we're working on all different levels with the healthcare sector and anybody influencing health of the population. Then what I'm doing is I am in Europe taking care of the Healthcare Climate Challenge, which is basically what I've talked about, the resilience, mitigation and leadership part for hospitals to join. So hospitals, health centers, and health systems can basically join, and I help them with their membership and help them finding the right calculators and applying for the Healthcare Climate Challenge Awards. and also for Race to Zero, which is an add-on program, basically like the highest level commitment in the mitigation, so the reduction of emissions. And how I got here, well, it's a bit of a weird parcours. I'm actually a pediatric nurse, and I studied international relations, and well, working with the healthcare sector on climate is very much in between both worlds of in between politics and healthcare. And but personally, I've always been super interested in sustainability topics. I've been with the Heinrich Böll Stiftung and the Extinction Rebellion. So it has always been important for me. And well, I guess Healthcare Without Harm is just a perfect spot in between that I found to do all of it at the same time.
Talking about climate challenges, you're involved in a project called Nurses Climate Challenge. Can you expand a little bit on what the resources are for nurses currently when it comes to climate change knowledge, and what Healthcare Without Harm does to, or hopes to provide with this kind of challenge?
So the Nurses Climate Challenge is trying to create a network of nurses in Europe to support each other, to learn about climate change, to educate other healthcare professionals about it, and to also advocate and change their practice to be more sustainable. And the resources we have there are on these, well, 4 topics. We created some resources, basic resources, to very quickly learn about what are the most important facts, how climate change is going to impact the health of our patients in Europe. And then we also created some presentations that nurses can just download and use immediately, so no need to sit down and actually create something themselves and just present it at a staff meeting, for example. And then what we're doing is we're collecting number of how many nurses are educated or have been educated by the Nurse Climate Champions. And it's quite amazing to see how quickly that has happened now and how much interest there has been in the last 9 months. We just started 9 months ago. And then for the practice part, the resources we have are case studies. So if there's projects of nurses who want to, or who did already successfully reduce the climate impact or the emissions in their ward, or build up resilience with their patients in some way, we write case studies about that and publish them for others to be inspired by it.
Great. I think those resources will be really extensively used. I know, especially in like the teaching profession, that people really want active resources that they can get their hands on and use straight away. So it's great to hear. So then moving on to sort of the international level, Sonia, can you explain your role as the International Climate Policy Director for Healthcare Without Harm, and what the Healthcare Climate Challenge is in relation to institutions?
So so my role is to support Healthcare Without Harm in terms of climate policy, and some of that's about how we're trying to really make sure that we have got good mechanisms for measuring the carbon footprint of organizations, and then supporting countries and institutions to put in place policies to move further and faster. I mean, we're in a stage where we need to be accelerating action. So I'm trying to make sure that everything we do is in support of that acceleration and that building momentum, and we are trying to work at 3 levels. I guess Anna's described to you how we are working with health professionals, then we're trying to work with institutions, and the Healthcare Climate Challenge relates to that, and we've also linked up with Race to Zero to sort of build some further ambition there. And then we're also working at government level, because where we're trying to get at the moment with the UK government and WHO some country commitments around both resilience and decarbonisation. So it's really about trying to support at those 3 levels people to be comfortable that they can take action and make a difference. And yeah.
Maybe you could just expand on what the race to zero is in relation to hospitals and healthcare systems in Europe.
Yeah. So Race to Zero is a program that the climate champions have put in place, and Healthcare Without Harm has partnered with them for healthcare facilities to be able to provide them a route into Race to Zero. So at the moment we've got, I think, over 46 organizations that have joined. I think that covers around 3,200 different hospitals and facilities in 18 countries. So the idea is that any healthcare facility that's interested can join, and they need to declare, obviously, that they're working to zero emissions, but well before 2050, and quite importantly, that they're focused on the near-term target of 50% by 2030. Although I must say that we've said that for countries where the responsibility for emissions is maybe not as great, that they could be on a slower trajectory. And we've published, sorry, I'm going to respond to the previous question now again and add something. We published a global roadmap for healthcare decarbonisation, which highlights what needs to be done if we want the whole of the health sector around the world to get to zero emissions. And we, as part of that, we developed 4 different trajectories so that we were differentiating between countries that really need to move faster compared to other countries who are still trying to establish their healthcare systems and should be allowed some more time to make sure that we can improve health as well as build resilience and reduce emissions.
Sonia, I'm just wondering, like a small follow-up question to this.
Yeah.
Do you know about any like positive example where you say like, wow, this in this country, they have implemented already like decarbonization strategies in the healthcare system? Is there any you could mention, or would you say?
Yeah, so I mean, so with the global roadmap for healthcare decarbonisation, we're now piloting with 3 countries or 3 authorities in Europe what that might look like at at country level. So the Netherlands, Portugal, and Lazio region in Italy have joined that. We are looking at having a second cohort of countries that would join that from a wider set of countries. But it would be fair to say that, everywhere around the world, healthcare facilities and healthcare professionals are really taking this challenge head on, because they know that this matters to health. And they are good examples about, how you can manage waste more sustainably. In Nepal, Malawi has signed up as a country commitment is the first country to have signed up to the COP26 health initiative. And in Latin America, there's an awful lot of work going on, not just in terms of building energy effectiveness, managing waste, but also looking at what sustainable procurement looks like because close to 70% of the carbon footprint of a hospital relates to all the products that we buy. And that doesn't mean that it's all the supply chain's responsibility, because like Anna's described, we as health professionals, we all utilize products, and the way we use them matters enormously. And if I can just give you a great example from Great Ormond Street, which is a children's hospital in London, the infection control nurses had noticed that the way non-sterile gloves were being used in the hospital was not appropriate, in that they felt that maybe people were doing it instead of washing hands, or people had gotten into bad habits around it. And when they re-energized a campaign with all their staff about when should you use gloves and how do you decide at each moment whether it's appropriate or not, they managed to reduce their glove usage so that they saved 7 tons of plastic in a year. And that is just one hospital. It just shows that if you really want to look at the way you work, be it as a health professional or as a hospital, or even at government level, there is an awful lot of areas where you can take action and make a big difference. And yes, we're seeing that all around the world, and it's very encouraging.
Wow, and that example also shows how important behavioral change is as well, and how big the impact can be if we change our behavior. So thank you very much for bringing that up. I'm really impressed by like the variety of the projects that you're working in, and I want to ask Anna about another project that you mentioned in the preparations, which is called the Nursing School Commitment. Can you elaborate a little bit on what are the goals and where have you observed success so far?
Yeah, so the Nursing School Commitment is a little bit of a, well, we've kind of stole that a little bit from the Nurses Climate Challenge in the US. They have already successfully implemented that. It's a commitment of nursing schools to implement include climate change and its health risks as well as planetary health into the nursing education. And here in Europe, we just finished the commitment document and we will launch it next month. And we have now at the moment 10 schools from all across the WHO European region who already joined in and are working on, actively working on including climate change and its health risks into the curriculum. And well, the idea of that is with the Nurses Climate Challenge, we are already like talking to all the registered nurses, everybody already working in hospitals and care homes and everywhere nurses work. But we need to systematically include it also in the teaching and in the, in all the universities and the curricula across Europe, not just piecemeal in one school at a time. So we're hoping to get like a lot of schools joining and with that change the curricula across the different nations in Europe.
You also have a positive example for us, maybe?
Yeah, like from the 10 schools that are already participating who have started writing the commitment with us, there's quite a few of them who have already integrated like pilot modules into master's courses. I think that was in Germany, the Hochschule Esslingen, who are trying that at the moment, or the University of Plymouth, their nursing classes. They have a sustainability prize for the students with the best sustainability project in healthcare, and like all of them are super engaged and looking into ways how to include the topics into the already existing courses, but also create new modules for the students that are especially interested in that, because that doesn't exist in most schools as well.
Just a follow up to that, Anna, have you found any sort of pushback from institutions or schools where they say that sort of the courses are too busy already to try and fit in more things into the curriculum, or have you found that generally schools are quite happy to adopt bringing climate education into their nursing teaching?
Well, a lot of the schools say that the curriculum is already crazy busy and there's not a lot of space to add new courses. But like the thing is that climate change is not only a new topic, it's not something that is add-on, it implements every of the subjects that we're anyway teaching in nursing. Looking at the health of, okay, now I'm going into my field, but looking at the health of mothers and babies, obviously they're going to be impacted by climate change, and the care that we're giving needs to be also well, resilient against those changes and not contributing to that. So not using a lot of single-use items, for example, for the breastfeeding and the breast pads and the bottles for the baby, for example. And on the other hand, we also need to know, if we work in elderly care, how heat waves are going to affect those patients. So, you know, it has to be really part of all the courses that are already there, instead of just being an add-on that is like a side course or an elective, because it is something that's going to be really changing the way we practice.
It's great to hear that people are getting on board with that. So yeah, that's great to hear. Just moving back to Sonia now and focusing on what I'm sure everyone is looking ahead to, COP26. We know that healthcare without harm is going to be involved at COP. I was just wondering if you can expand on how you're going to be involved and what your goals are for COP.
So thank you very much. I mean, it's great this year because the COP26 presidency has recognised that health is a key aspect of climate change to be taken into consideration. And we've been trying to highlight that this is not just an environmental issue, but that it is a health issue for quite some time. So that is, you know, really positive news. And so there's a lot of things that where we are using COP as a mechanism to highlight that and to move beyond. So one program that we're involved with is with the COP presidency, the Foreign and Commonwealth Office for the UK and WHO and ourselves, where we're seeking commitments from countries around the world to declare their ambitions around resilience and around decarbonisation. And to our great surprise, you know, countries are signing up to this, including ones that you might think would find it harder to start looking at decarbonisation, like Malawi. So that is going to be a big moment, trying to celebrate that these countries they're not committing to COP, they're committing to their people in their countries that they will do this. And that's what's so important, is that actually any kind of ambition and commitment is made to the population, so that you know, the work that goes on, you know, the COP is only a moment in time. We need to use it as a mechanism to try and build greater ambition, but mostly to trigger more action. So that's one example. Another one that we're very excited about is that because we're Race to Zero partners, we are working on a sort of a future labs event, which would be, well, what would the future of healthcare look like? And so we're working with a number of different organizations to plan a thought-provoking moment, really, which isn't so much to say this is what's happening now around the world, but it's a lot more to say, well, what do we need to be thinking about in the future if we really want to be serious about transforming healthcare in a way that is going to be compatible with climate change. And I think what Anna's talked about is some of the transformations that need to happen at a clinician's level, but it needs to also happen at institutional level and at country level. So that's super exciting. And, you know, there's going to be a lot of other health events that we're involved with. We are hoping, and I think we probably have landed on having one overarching message for all the people that are working on health towards COP. So, you know, WHO, Wellcome Trust, Healthcare Without Harm, or a lot of different organizations, where we hope that we will have one strap line that unites us all, so people can recognize that actually this is a real collaborative moment that we're working towards, even if there's going to be different angles that will be spoken about in different ways. So there's a lot happening in the health space, and Great Ormond Street that I spoke about earlier are organizing a professional bike ride of some of their doctors to go from Great Ormond Street to Glasgow to deliver a letter that's really a call from health professionals to COP to say, look, this really matters, it's a health issue, please take that into consideration. So, you know, we are not involved in the negotiations per se, but what we're hoping is that more and more people are beginning to realize that the impacts of climate change on health and what the health sector can do to show leadership really matter in this world. And so we're quite excited.
Yeah, I started to see that at COP25 talking about the importance of health, and they were trying to gain momentum. So hopefully the 2-year lag is to the next COP26 is hopefully built on what was trying to be achieved at COP25, and yeah, it can be brought higher up the agenda. So a final question for you both is, looking ahead to 2030, what are your hopes for changes in the healthcare system in relation to climate change? Sonia, do you want to maybe go first, and then Anna? Okay, so I mean, my hopes are nothing less than full-scale transformation, because that's what we need to do. So the global roadmap that we developed really highlights that even if you have zero carbon buildings, zero carbon transport, zero carbon food systems,
we will still need to go further. And that's because if you look at healthcare across the world, we've got a growing population, we've got growing issues and diseases, pandemics, things that we're going to need to be dealing with. So we really need to work hard to deliver health differently. And that is in the order of transformation, significant and systemic and systematic transformation. And so it will require every health professional to consider their health practice and how that can be changed, every institution to think about how do we deliver better health, not just sickness, dealing with sickness. And then at every ministry or health system level to think, how do we, what does a good, sustainable health system look like? And there's a great opportunity for countries that are sort of still developing their health systems to not follow the Western model and build big hospitals, very intensive kind of mechanisms, but actually to try and do like in Africa, to really strengthen some of the primary care capacity and support, health at local community level. And, some of those countries have done quite well in dealing with a pandemic because they've had to learn from previous experience with Ebola and other issues. So I'm hoping that during this next decade, we can also learn the other way around and really work towards health systems being about delivering health and creating health, and maybe less focused just on sickness. That's my dream.
And well, I absolutely second this. There's not a lot to add, I think, except that I hope that all the changes that will happen are going to happen in a way that includes everybody and that allows innovation from all the professionals and all the patients that are involved in this healthcare system, so that not any good ideas that might help us all are lost on the way just because they came from the wrong or from a marginalized person.
Great, thank you both. That's the end today of the interview. So many thanks for joining us to discuss the healthcare and climate change. And we will let people know where they can contact you or find out more about the work that you're doing. Thank you very much.
Thank you very much.
Thank you.
Thank you.